Hello everyone, thanks for joining the second Cadet Careers Talk event in honour of the Cadet Centenary and the Year of Youth. My name is Gabrielle Hobson and I'm District Cadet of the Year for South and West Yorkshire, and I'll be tonight's host. I'm joined by Lucy Peart, who is a newly qualified mental health nurse on a mother and baby unit. So why did you become a mental health nurse then?
So I think I've always sort of been a caring person. I've always been a bit more interested in sort of people's emotions and how they're feeling. And I originally wanted to go into general nursing because I've always sort of, I think I've just sort of had that personality to care for people. And then as I grew older, mental health was sort of just everywhere, so it became a lot more spoken about. My own family members were experiencing it, my friends were experiencing it, and I think in the community I was behaving very much as a care coordinator, which is someone who sort of guides people in the direction of help and offers them sort of one-to-one sessions and things like that. So I thought I would love to be able to learn more, to be able to help them, and in at the same time help other people. So yeah, I decided to study mental health. As I was growing up, after experiencing different jobs in care, I did spark an interest in learning difficulties, which is also a specialised nursing course. And I was very close to starting that, but I think just because of how prominent mental health and mental illness is, it was just an interest of mine. Yeah.
Did you originally intend on working on a mother and baby unit then?
No, I didn't. I was originally just, I never really went in with any sort of idea of a specialism. I was like sort of mainly interested in just sort of general mental health. When I then started training, I did have a big interest in eating disorders and adolescent mental illness. And then I did because you do different placements while you're studying. Mm-hmm. And I just found, and I did do a placement on a general ward and I loved it, and I thought that's where I would end up. And then I did my perinatal placement, and as cliche as it sounds, you just find where you're meant to be, and that was it. I just, like, the learning was easy. So what I mean by that is when you find something that you actually enjoy, nothing is really a challenge. So even the learning, even the challenges, they're not challenges. You just sort of fit in and run with it. Yeah.
I agree with that. So what does an average day look like for you then?
So an average day sort of on the unit would be, I mean, the shift patterns are in hospitals, they are quite challenging. They're 13-hour days, but the time sort of, it does go very quickly because when you're in charge, essentially, there is a lot to do, so time goes by. You spend the day sort of having one-to-one sessions with the mums, learning about their lives, their situation, offering them support. You're working with doctors and other professionals. You're working with nursery nurses, which is incredibly interesting, I find, to help with the bonding with the mum and the baby, because there's quite a lot to do with that. Obviously, if you're struggling from a mental illness and you're in fight or flight, it's very difficult to focus on anything else, let alone looking after a baby. So creating that bond is a prominent aspect of a day. So yeah.
So following on from that, what skills do you need to be a mental health nurse?
I think to be sympathetic, empathetic. I think a lot of the training there's only so much training you can do when somebody's sitting there talking to you. You have to be able to understand. You have to be able to, listen. Listening is key. The uni had always taught me to be inquisitive. You have to be an inquisitive person to sort of ask lots and lots of questions to figure out sort of underlying, because mental illness isn't black and white at all. You have to sort of keep asking questions, keep digging deeper. So I think you have to be that sort of, I think being a nosy person is quite a good aspect to have when you're in mental health nursing. And you also have to have good leadership and good sort of coordination skills between other professionals, because mental illness isn't, again, black and white, so you have to liaise with lots of different people to offer that recovery.
Because I'm sure that mental illness presents very differently. It might be the same thing, but it's very different depending on the patient and the person.
Yes, yeah, definitely. I haven't met a single person who experiences, for example, postnatal depression the same. They're all very, very different.
So how do you prepare yourself for a night shift?
Night shifts, I think they can be very challenging. You sort of just prepare yourself by, I would stay up all night and then sleep for the whole day to be able to sort of prepare in that way. And things are very different, so it would be a case of speaking to the professionals that are used that do night shifts and things to understand how it's run, and just being conscious of your sleep pattern and working around that. So I'm somebody who sleeps a lot, so I would make sure that I sort of planned my day. It does take a few days before the night shift to prepare for the night shift and after, I would say, for sure. But I do know some people that they don't really prepare. They don't, in terms of their sleep pattern, they don't really prepare at all, because they'd be fine to do one whole night and then figure out afterwards. So I think it all depends on your own personal sort of, your own, your ability to cope sort of overnight. Yeah,
definitely. So what has been your biggest setback in becoming a mental health nurse, or as one, or even both?
Sorry, what was the last bit?
Your biggest setback, either as a mental health nurse, becoming a mental health nurse, or either, both, if you've had setbacks.
I would say, I would actually probably say the training is very very difficult in terms of, because it's a complete life change. Becoming a nurse, it's not just sort of, I wouldn't say it's a career path, it's a life path. It does take some time to adjust because when you're a nurse, it's not just you have to behave as a nurse sort of all the time. You have to continuously be professional wherever you go, and the studying is very difficult. With the getting used to the hours, I find is difficult. But if you're doing something you love, you can't, like, 13-hour shifts isn't a big deal if you wake up if you have a reason to sort of get up and go, and you love what you do, and there's people depending on you, I find makes it a lot easier. So I would say, the answer to that would probably be the studying. I think there were a few times where I queried whether this is the right path for me, because of how challenging it is. But once you get through it, you just got to keep pushing, because once you're there, it's totally worth it.
Definitely. So how do you prevent the emotional aspects of your job affecting your personal life? Because I'm sure you must see so many difficult situations.
Yeah. I think that it can be hard. I think making sure you have somebody to talk to as well, and that you look after your own mental health. But I think having such knowledge of mental illness makes you sort of self-aware at the same time. talking to the professionals that you work with. I'm lucky I work in an amazing team, and they do offer the debriefing with things that are challenging. Our professional psychologist on the team, she is available to talk to all the staff as well. So again, make sure you speak to professionals, make sure you speak to the people you work with, and taking time for yourself too, to sort of talk about. I make sure that I sort of after a shift I spend an hour just talking about it, and then that's it. So I would sort of get it all off my chest, have that time to sort of debrief, de-stress, and then just try not to sort of mention it again, because then you are to sort of taking it home with you. Also, if I find things challenging, to again allocate time, where say like I give myself like half an hour to just be emotional about it, because there's nothing wrong with feeling. We will need to feel, and that's what makes you a better nurse, is to feel. And so I give myself that time. I give like half an hour to feel, and then because if holding it in will eventually burn you out and change you from being the nurse that you wanted to be, like without you realising.
Yeah, definitely. Did you ever see yourself going in another profession then, whether that be healthcare or anything else?
I think I've always wanted to be sort of in a caring role. I did think about, so for example, anything to do with sort of frontline workers. So I questioned the army, I questioned police force, being in the fire department, so all that sort of that role. So I did question it as growing up, but I just found sort of as I got older, mental health was my sort of department. Yeah
Definitely. So if you could give your 16-year-old self, a piece of advice, what would you give yourself?
I mean, I wish I sort of knew the mental health knowledge that I know now back then, because being a 16-year-old in this sort of day and age is very, very challenging to your mental health. So I would say that probably that it doesn't matter. So what I mean by that is there's so much that you worry about when you're 16, and there's so much that, like, things that bother you when you get to 20, 24, 25 and you've got your career. Those things really aren't, they're so minor that they shouldn't have been stressed about for so long, and that you will get to where you want to be, and things that, say for example, people are saying or doing won't have any impact on where you'll get to, and when you get there they won't be in your life, or they won't be. So to not worry about the little things, really.
Yeah, definitely. So if there was one thing that you could change within working in mental health, what would it be?
I would probably say the stigma would be, we do get a lot, because with working with babies as well, we work with general nursing as well, and they have very zero to little knowledge on mental illness, and there's quite a lot of stigma. So we get a lot of sort of social workers and things, and they just see mental illness as they're completely incapable of sort of looking after their baby, and they're very sort of judgmental. So I would change a lot of that. I would change the access to mental health when you're studying general. So I made quite a lot of friends with general nurses when I was studying, and they weren't. So as a mental health student, we have to do the first and the second year of studying is very generalised, and we studied with the adult students. That's why I sort of became friends with them. Whereas there was nothing like vice side, if that makes sense. Mm. So we did a lot of general knowledge. They didn't do a lot of mental illness knowledge, which I think is where I think that gap is. So I think it would be nice to have them to do a mental health placement or something like that, so that if you do choose general, it is just as important to focus on mental health.
Yeah, definitely, because that's quite interesting, because of course no matter, if someone's going in for kidney treatment or something like that, they may still have a mental health issue that they might have to deal with, which of course if you don't have much knowledge about it would be very difficult to deal with or treat.
Yeah, for sure. I mean, we get children specialised nurses come to where I work because of the babies, and a lot of them, they say, oh, I don't understand, they don't understand why they're on this placement. And I say, well, because you're looking after a child, but then you forget about the parents. The parents are just as important as the child that you're looking after. And this place focuses on the mum's mental health. So it's good for you to open your eyes and your knowledge to both. And I think you would be an excellent child nurse if you were aware of mum's mental health and dad's. So it's good. I think if you went into nursing, it would make you an excellent nurse to sort of look at all of them, even sort of midwifery, child nursing and mental health nursing, no matter what subject you've chosen. Yeah.
Do you believe that being a woman has caused you to face more obstacles than your male colleagues or counterparts?
Personally, I would say no. I've actually witnessed it to be the opposite way round. That men, I suppose it depends on what area you go into. So I have noticed, for example, in female specialised wards, it's more appropriate for you to be a male because the same genders clash and vice versa. And on adolescent units, it depends. But I think as studying, it's been quite the opposite. That men would find that more challenging, especially where I work with the mums and the babies and the stigma behind men.
No, definitely.
Yeah.
So I have a few questions that have been asked by the cadets that are on the court. So what are the GCSEs or A-levels that are needed for nursing, and from that, what grades are needed?
Okay. So I had, you need to have to get into uni, you need to have I believe it's either a science or and for GCSEs C or above. I'm not sure when you're talking like 1, 2s and 3s now. I have no idea what that means.
I think a 4 is a pass and a 5 is a good pass.
Okay.
There's some, I think it's along those lines. I should know. I did my GCSEs last year.
Oh, it does make me feel old now, and I'm not, that they've changed it all. But they do, when it comes to nursing, they are more sort of, so I never got my sciences at school, so I ended up going down the care route. So I think we didn't have access to sort of, they do like home economics and things like that, but I did my health and social care in college. So if you're somebody who didn't get what you wanted in school, the universities, they do accept it from other ways. So they do see that the education is still there. So they think, oh, okay, they didn't get the biology, but they have got the health and social care, which is how I sort of got in. So yeah, they want the C's or above there, but then you do also have, because I was never good at maths ever, so I actually did an access course at college, which is also available. So if so 4 C's or above and a science, or 4 C's and above and a health and social care at college, or you can always do the access course, access to health and social care, which is how I did that. I think the uni actually see that as, I believe when I applied, that's what they looked at, was the health and social care qualifications, the access course, sorry.
Yeah.
Because that's the level 4 thing, and then uni's level 5, so they see it as that climb.
Definitely. So what would you say is the most rewarding aspect of your job?
I would probably say the the recovery when they get better. I think that's why I also enjoy perinatal, because there is always that, you always see the recovery, whereas in some aspects of mental illness you don't always get to see it, and I think I like that sort of the closure again for my own sort of mental health. I like the closure of it, and also that with perinatal it can often there's that cause, and then there's often it's a fix, but it's a slow fix. So I like that. Yeah, we see lots of recovery and bonding with the baby and families, and yeah, so that's the best part, that we helped, and that they're better and they've gone back home, and yeah.
Well, that's all you want, I guess, is that they're better.
Yeah, exactly.
So what is the most common mental health issue that you see then?
For me, I have seen predominantly, I would probably say psychosis is quite common, because I work in the hospitals. I think if you were, say, a community nurse, or you worked or you specialised in like elderly care, it might be slightly different. But for me, I've seen quite a lot of psychosis, which can often happen due to lack of sleep, and obviously with new mums, and the hormones and the trauma from birth, and then not sleeping, it quite often ends in psychosis, which it can be incredibly scary for the mums, and it makes you empathise, because I've seen patients that have had children, and then they haven't recovered until 6 months have gone by, and then because they've been psychotic, they don't remember any of it. So they've given birth, and then their baby's 6 months, and they were like, "What happened? Where did it all go?" So it can be very, very challenging. But I would say that's predominantly the one that I've seen the most. Even like any type of psychosis, really. So drug-induced psychosis, lack of sleep, pregnancy, postpartum psychosis. Yeah. So.
Would you be able to explain what psychosis is so that our cadets can know? That's okay.
Yeah. So psychosis is normally, from the way that where I am, we see it as they start they hear voices, they can often, sometimes they have auditory, so a lot of the time it's hallucinations, so they hear things or they see things, they behave in a complete sort of different manner from their usual. They can be erratic, they can be, some can be aggressive, or they can go almost catatonic, which means that they've become sort of unresponsive, so they've been depressed. It's almost extreme depression, so the symptoms of depression, sort of not having any motivation, not eating, not drinking, that, but the extreme version, and that becomes psychosis when they behave like that, but they hear voices as well, or they see things, or so and the same with sort of drug-induced psychosis. So it's drug-induced, that they are hearing, having auditory hallucinations, behaving very differently from their usual. Yeah, does that make sense?
Yeah, it definitely makes sense. Thank you very much for your explanation. So what has kept you motivated to stick with your current job?
I think just the interest, the fact that you learn something different every single day. You are never, I'm sort of the type of person that wants to sort of keep going. I don't ever want to sort of end. I'm not the type of person that's like, that's it, that's my career now, that's me forever. Because I think the idea of that sort of scares me a little bit, just being there and that's it. The never-ending learning, the career opportunities, the ability to sort of chop and change. So even though I've specialised in perinatal mental health, if I then wanted to move and go into eating disorders or wanted to go into elderly, they encourage that. So it's not necessarily that's you now, sort of, because in other aspects of work, if they say, oh no, you're I don't know, you're an IT specialist, why do you want to come into the fire department? Do you know what I mean? Like, yeah, so whereas they encourage you to do that, and I sort of like that I'm not stuck.
Mm. Do you see yourself in the future then moving to a different specialty?
I mean, I would. I don't know. I wouldn't. I can't. If there's so many learning opportunities in perinatal that I may climb up, or I may, because like I said, you learn something new every day. So I might learn something and go, oh, I really am interested in that. Let's sort of go down that path. So I really, I don't know.
And then it's fine to not know, I guess. Yeah. It's nice that you have the ability to go down the stuff that you enjoy.
I think, and also I do think that the team that you work with is important. And I haven't found a better team than the one that I'm at. So, yeah, I can't picture myself leaving that team at the moment. No.
I understand. So I believe that is all the questions that we have.
Okay.
So unless anyone else wants to quickly ask one, I don't believe that there's any more. So I'd like to thank you all for coming to today's event, and thank you to Lucy, of course, for coming. Please, if any of the issues that have been spoken about today have affected you, please speak to someone. Don't keep it inside, as we said. It's good to talk. And the next talk will be on the Wednesday, the 23rd of March, and we'll be hearing from a consultant paramedic. So hopefully we'll see you there again.